So Bobby, this is David.
It's Angela Rodriguez, ELD.
Hi, Angela.
Hi, Bobby. Jenny Mendoza, Research Associate at the U of L.
Welcome.
And Beth Day, I'm the Hub Director for Lane County. Christy Collins, Director of the Early Learning Hub for Lynn, Benton, and Lincoln Counties.
Sylvanie, Deputy Administrator for Program Design and Self-Sufficiency.
Alicia Meow.
Wonderful.
ELD. Emily Berry with Healthy Families and Insight Teen Parent Services.
Tom George, Failed Technology Expert, ELD.
Not your fault, Tom.
And on the phone?
Well, this is Bobby Weber. Debbie Jones,
I think she took care of it today.
Debbie Jones, Early Learning.
Sarah Kleinschmidt from the Oregon Health Authority.
Catherine Urino with DHS Research.
Hi, Catherine. I didn't get which, who is it from OHA today?
Hey, Bobby, it's Sarah Kleinschmidt.
Oh, great, Sarah. Sorry I didn't get it. Okay. Okay, and Catherine, welcome. Anybody else on the phone? Okay.
Just to make sure I got this right, on the phone, Debbie Jones, Sarah Kleinschmidt, Catherine Urino, Bobby Weber. Is that everyone on the phone? Okay. I'll take that as a yes. I like having the list down because then it just reminds me to remember the folks on the phone. So Bobby, do you want to take it away?
Yes. Welcome, everybody. This is strange for me to be on the phone. As you may have picked up, I'm at the beach. And it was just too hard to drive back into the valley. So, well, too hard emotionally. So we are, first of all, I want to say how grateful I am to all the people who put so much time and effort into the homework. We really appreciate it, and it provides an amazing foundation for the work we're going to do today. And you can see from the meeting goals that we will be now building on the work that was done and addressing. One of the things that people did was raise important questions, and so that will greatly enhance the conversation that we're going to have, and Tom will be synthesizing the feedback we got. So I'm just going to review the agenda and then turn it over to Tom. We're going to spend a good deal of time moving from the homework to some decisions in the three areas that we addressed in the homework about I think of it as assessing kind of the comprehensiveness of the library that we've created and looking at it from different perspectives to see if we have redundancy or if we have gaps. Probably gaps are the most important as before we move into the next steps, which is what we will do at the when we're done with the review. We're going to move into the next step that we're going to take on assessing the library from an equity sector review of the measures. So, Tom, if that all makes sense to people, I'm going to turn it over to Tom.
And Bobby, do you mind if I sort of ad lib for a second? And I know we didn't talk about this when we were talking about the agenda today, but I was also just, as I was thinking about today's meeting, also felt like it was also good to think about where we are in the process and a little bit of timeline, and maybe we can come back to this at the very end as well, but I thought maybe also would add this up front. You know, just sort of thinking in terms of due dates and deliverables. The Early Learning Council strategic retreat is scheduled for, I believe, late October. And I think it would be really good to have sort of a product or recommendations to bring to the council at that October meeting, which would then, I think, mean for us to be at a position maybe, hey, in September to make recommendations, you know, to be a place in September where we could feel good about making recommendations to the council in October. I think potentially one of the implications of that, and we can come back to the end of the meeting, I didn't mean to hijack things a little bit, but it just felt like it was maybe good to get some of this stuff on the table at the beginning, was we probably have work to do over the summer, right? So I think that was the other thing to also think about. So I apologize for hijacking because we didn't talk about this when we talked about the meeting, but as I was just sort of thinking about today and some questions I've got, I thought it would be good to sort of at least put up front on the table what I think is the timeline in front of us, and then maybe we can also come back at the end and as part of the discussion on the equity review, also think about what are the next, if October is that, you know, if October, you know, if having a product that we can all embrace in September in order to give something to the council in October, what do we think is the work that we have to do between now and then?
Correct.
Which is 4 meetings after today. One of them is on July 3rd, so nobody will be here. And August we usually take. We don't have many meetings left. We have 2 meetings.
Right.
Yeah. All right.
We can move, Tom, we can move July 3rd to another day. We don't have to give up the
July
month.
4th. Yeah. So, you know, people's calendars are very free at the moment, July 4th, not a lot of meetings on there.
Wide open.
Right.
And also just for the folks on the phone, just one more introduction.
Hi, this is Beth Green from Portland State. Sorry I'm late.
Hi, Beth.
Hi, Bobby.
We're glad you're here.
Trying to multitask.
And Chelsea Bunch popped on the phone from OHCS. I'm sorry I'm late. I was just got off the road.
Well, welcome, Chelsea. We're glad you're here.
Thank you. Happy to be here.
I want to thank those again, like Bobby did, for who completed your homework. You obviously put a lot of thought into it and made a lot of questions, and they were all read and reread and considered, and hopefully you'll see some reflected. But I think from color coding schemes, the bigger manufacturers, the number schemes, and other factors that scoring systems that people created were all interesting. And the first comment about in general was, it's clear that we're a bunch of systems thinkers. Everybody sees everything aligns with everything else. And that became difficult, especially in looking at developmental domains.
Yeah, this is tricky. Yeah, like, and it belongs there and there and there and there. Yeah.
Tom, I thought we were doing developmental domain third. Are we doing it first?
I think Tom was going over the high-level feedback he got before we went into the exercise.
I see. Okay.
Yep. And there are some other issues that are big issues which we will address throughout, including the issue of access to care versus quality of care. It came up a lot. What's the long-term goal and what's the actual intermediary goal? We'll address some of those. And some other things that we'll address in my comments as we get there. So we'll jump in. Did anybody have just any general opening comments they wanted to make? Brief remarks about the exercise? I can't make interesting homeworks anymore because they're too hard to review when I'm finished.
It was a good activity. It was, yeah.
Okay, so we're starting with probably the most difficult of the tasks, which is mapping the measures to Raise Up Oregon. And the first issue, as you can see that's highlighted on the handout, sorry those on the phone, hopefully it's on your screen. It seemed to be a general consensus, well, to say that, more than two of you mentioned the thought that adequate birth weight was not a great long-term measure. It's a tricky one because the goal is arriving at kindergarten ready to succeed, and adequate birth weight is quite a ways away from kindergarten. One suggestion would be to move it under Objective 4, early childhood physical, for health in general, if it pertains to the child.
I'm gonna do one thing that I had meant to do before today's meeting, which was print out our principles of long-term and medium, because I think that'd be actually good to have in front of everyone. So I had meant to do that and then got pulled into another meeting and didn't hit print copies of that.
And in general, our intermediary, we think of moving in hopefully 2 to 3 years, long-term, maybe 5 to 10 years. Intermediary, and this comes up as well, the issue of what's an indicator of an outcome and what's more like a leading indicator.
Right, just like Shannon raised that, is it an indicator of the construct, or is it something that predicts the construct?
Yeah, it doesn't precede.
Right.
And that was just too weighty for me to take on.
Can we comment at this point, or do you want to save that thoughts until after you go through it?
Let me just go through the changes, the suggestions to the long term, and there's only like 3 or 4. So the next one, reading to children, some people suggested is better under Objective 1. Family supported and engaged as their child's first teacher. And then for Goal 2, a suggestion to move 2 from the intermediary up to the long term. One was young kids in poverty. I think that was pretty much widely agreed to. And the other one is a little more debatable, percent of families earning a living wage.
Well, both of those, we'd be lucky to move in 5 years and make progress, so.
Yep. So again, we want the long-term measures to be more population-focused. Again, the period of time to move it, and that's more of a systems goal for where everybody is kind of involved in moving the needle in some point. So those were the suggestions. So those 4 measures are suggested to switch places. Sarah, did you want to make a comment about any of these? Or I think we were talking about birth weight.
Yeah, specifically about that one. I guess I would have a concern about moving that to an intermediary measure, particularly, for example, if you look at number 4. I mean, those are all, if you can scroll down to those are all process type things that, we can get kids in for their well child visits, that type of thing. Adequate birth weight is not something that you can move quickly, and there are multiple factors which impact that. I just don't see how we would move that in a shorter period of time, and because it is so multifaceted, and the quality improvement efforts that you would put in place to address that are very different than what the other things that we had listed as intermediary measures here.
Okay, the problem with adequate birth weight, Sarah, that we talked about was that it isn't it's important because of all the connections it has for the rest of the lifespan. And putting it here as a long-term system measure, that was what I heard from some of the comments I read was, and why people thought you know, if you were doing a logic model, you wouldn't put it at the, the one thought was you wouldn't put it at the far right. You'd put it more as predictive of other things because of its impact. So I think there's two levels. One is how likely and how complex is it in order to make a move on it, which is the thing that I think you addressed. And the second is how does it fit into what we're doing in terms of is it a predictor or an outcome?
And I totally agree with the latter part. I can see very much the logic of it doesn't fit in with the latter. You know, it probably is more of a predictor than an outcome. I just would then have concerns about putting it in our framework as an if it doesn't fit here, I also don't think it fits as an intermediary goal for the reasons of in terms of you cannot move that in certainly not 3 years.
So I feel like there's sort of two issues as I'm sort of listening to this conversation. Because it seems like if you're sort of looking at from the sort of perspective of
age ranges.
But I think it's not an age range question, right? The way that we've defined the measures, right? So we're not sort of saying, I mean, I think what's getting, you know, it's not that there's a logic model that leads to kindergarten readiness in the same sense, right? We're sort of saying in terms of the big buckets of key outcomes for children and families, right? So for me, maybe the question is more, this does feel like an outcome, right? It really tells you all a lot about pregnancy and health. So I guess one of the questions is, you know, in addition to medium versus long term, is the question, is this better placed under the section that also gets to the goal 2 that also includes parental health?
That's where I was leading, yeah.
Yeah. But then that would make it intermediate, intermediate.
No.
You'd put it as an outcome for goal 2, a long-term system measure for goal 2.
Right.
Yeah. Oh, well, that would, okay. That'd make more sense than for goal 1.
One thought,
I kind of like.
Right?
That's really interesting. It's just, yeah.
I think what we're getting caught up is it's like at birth, so it's on the way to kindergarten readiness, but in terms of sort of being like an outcome rather than a sort of, you know.
Mm-hmm.
When you look at health equity, it's often under healthy, stable, and attached families. It's not. It's an outcome of family systems.
So that was just one thought. I don't know if that's the right way to go.
So Sarah, I like that idea of moving it. I don't know if that addresses everyone else. The second part of what Bobby was talking about, to me, from you know, putting it in a logic model, it makes much more sense there, and it also pushes the focus on truly being family-centered care, which I like.
Okay.
Yeah, and it's just a natural extension of all of the measures in Objective 7 too.
It does create a different problem, though. It's that there's no long-term measure that's associated with the health of the child in this section. So it does create a different problem moving it there, which is why I think it ended up there.
Yeah.
So just also want to call out, like, I think there's still an issue.
I know Angela raised a good issue, which is there a measure of adequate weight gain that might be more appropriate? Or would healthy BMI at kindergarten entry be more appropriate?
That's more appropriate to me, in line with what the point in time issue, right?
Mm-hmm.
So would it be immunization rate? Because it's well-child visits, so well-child.
Do we have a measure of healthy BMI? And also the Preventive Services Task Force just came out with some guidance saying that I mean, in terms of like weight gain and looking at BMI, you wouldn't start until they're 6, which I guess would get kindergartners, but it might be sticky in terms of evidence around how you define healthy weight for kids of that age.
But there's a definition for 6?
So there used to be some guides where they would look even at 3-year-olds, and now they said no, we really shouldn't, because it just changes so much with kids, and that you wouldn't even really start looking and having intensive interventions until they're 6.
So
and I also don't know what data source you would use for that.
This is Debbie. My question on that, are we looking at, healthy birth weight, or are we looking at an obesity prevention target? So I guess I have a question as far as what are we really actually trying to measure?
You know what? This is Bobby. I'm on the phone. And so it's hard to know. Where have we moved? We were on long-term system measures for goal 1. Where are we now?
In place.
How did we get to obesity?
My fault. I made a suggestion of moving the low adequate birth weight to goal 2.
Right, I followed that.
But that created another problem, is that this is consistent with the strategic plan and the objectives, that child health is part of school readiness. And that's been a sort of a shared conversation. So what we end up with, no long-term measure that's associated with child health. So it felt like now a real gap, a real conceptual gap in the long-term measures. So Beth had suggested BMI.
I see.
As a potential, or Tom had suggested, sorry. And Sarah, you were saying that there is a possibility of something at age 6.
I'm saying I wouldn't use BMI because of all of these issues with the U.S. Preventive Services Task Force, and they're calling out,
got it. Sorry, I misinterpreted what you said. Sorry, my apologies.
No, that's okay.
Okay.
I'm just curious if it's possible to use any of the work that's happening around the health aspects of kindergarten readiness that OHA has been working on. Is there something in there that we could potentially?
They're not outcome measures.
Okay.
They're really incentive metrics. So I don't think.
Okay, I see what you're saying.
So I think we did look at the map in other places, but in terms of sort of long-term population outcome measures, I don't think that was really their focus.
Okay.
I'll just throw out that I think we should note somewhere very strongly that by moving to adequate birth weight to goal 2, we now have an issue about finding a long-term health goal, but don't do it now. I mean, I don't think this is I think we should finish the activity. Don't lose that. That's important, but keep going with Tom's process that he's done.
Yeah.
It's not like health isn't represented. We've got lots of health stuff under objective 4.
Yeah, right.
Okay. Any other comments about long-term, short, medium-term, moving things around? I mean, just in terms of those big switches, maybe more will come up as we go through them.
And
are we all in agreement? Tom, are we all in agreement to move reading to objective 1?
Ready to move? Yep.
Okay. Great.
Okay, objective 1, home visiting measures. So the changes, home visiting was suggested to move under objective 8. It came up in another suggestion to move it somewhere else. Objective 8, all families with infants have opportunities for connection. So the home visiting would either could move under that, or we could add another measure for 8.
Well, given that there's nothing under 8.
Right. I mean, it's hard because parenting ed is under objective 1, and a big component of home visiting is parenting ed, although they wouldn't call it that necessarily. So it makes it a little bit apples and oranges to move them to different categories. I see that home visiting supports both, right?
And I'm trying to go back to the original conversation. I thought that the idea was not to have here an access to home visiting measure, but to see if there was some of the shared measures for children or families who are in home visiting that could get at an outcome associated with it. So it would be still an outcome, but for a subpopulation that was in home visiting. I think that was where we originally started that conversation, if my memory is correct.
Well, I guess it could be that you can visiting engagement in 1 and home visiting retention in 8. How long they stay.
Well, I would think of those being together.
And there's service engagement, so I'm not sure. They're just different than the other ones, right? Because it's not really an outcome. It's service. How engaged are they in services?
Seem like the parenting ed measures.
Parenting skills ladder is outcome, but attendance isn't.
But these intermediate measures don't have to be outcomes. These are ones that we have reason to believe are going to lead to outcomes. Right?
Yeah. Right. You're right.
And this objective has 2 strategies. One is expand parenting education, and the other is to scale home visiting. So those were the natural fits for those reasons. So it sounds like we want to keep home visiting here.
When you think about it that way, it's that systems issue. Like it's also objective 4, and it's also objective 5.
One or the other, we not keep it. I think eventually, we actually do need a mapping with the objectives.
Like at one point I thought, like home visiting has different outcome indicators. What if they were spread out? So like, I don't know, every outcome.
A number of them are already
they're
in
not
here,
here,
right? Yeah, they are.
But if I'm trying to go back, I thought there was some thought that you could pull out from the home visiting data some data point on development of parenting skills for parents who are involved in home visiting, that there might be an analog for the parenting skills from the home visiting.
They're slightly different. We reviewed those, but people were open to.
Measure reading, books in the home, and parenting activities, skills.
I think we went back and forth on the word engagement versus retention, because it's like home visiting is kind of like dosage based, like the longer you are in it, the more.
It almost feels like the service-related levers need to be pulled out somehow, because they're, at least home visiting and parenting ed, for that matter, would address so many of these. Because they are outcomes. Like if you look at the healthy families or the NFP or any of those models, logic models, you're putting the service and the intermediate outcome in the same level, which is weird to me, but I can get over it.
And I think my comment on this one had to do, especially under Objective 8, of what the data points will look like for Family Connects, because that's exactly what the measures will be, and so we'll have future data collection there. We might not have the perfect now, but we know there's a lot coming.
And I think that was part of why that objective ended up being blank, right? Because it was really, in some sense, just to be honest, in terms of development of the plan, that was an objective that was built around the strategy a little bit, and less than having the strategy built around the objective.
I mean, almost all of the rest of them, except for the home visiting, engagement, retention, and parenting ed engagement the child care ones are access to services. But that's because the objective is access.
The objective is access, right?
So maybe we just pull them out. Do we need them?
To which one?
The home visiting engagement and parenting ed engagement and retention.
And just leave the parenting, the parent skills ladder. And then would we also add a similar one from home visiting?
Frequency of reading.
And your frequency of reading
Okay.
some of our outcomes
Okay.
for home visiting.
So parenting skills ladder, because that's also in lots of home visiting programs too.
So just for the folks on the phone, I just want to, Allison, make sure I heard everything correctly. The suggestion on the table is for objective 1, the intermediary measures would be the frequency of reading, the parenting skills ladder, and was there a third? And just those 2. Okay. With the suggestion on the table. And to pull out the ones that are more about program access.
And where are the engagement, parent engagement skills?
They could be with access. Well, I don't know, it's already stated as high quality, affordable early care.
I mean, they could be there because it's part of access, but it's stated such as it's early care and education.
Could we just delete, do we have to put it somewhere? Can we just take it out? Because we got a lot.
No, we're going to be limiting our list, so we don't have to move things. We can take them out.
Yeah.
I'd be a little cautious in taking them out, though, of the measures around engagement, because the objective itself is that they're supported and engaged.
But engaged in their child as their child first teacher, not engaged in a program. Okay.
And I think the way you'll know, like the home visiting like the engagement or retention is working, is that frequency measure will go up and the parenting skills will go up.
Okay, should we move on to objective 2?
Okay. Families have access to high quality, affordable early care and education. High quality being here the key phrase, key word. Number of children with access to a child care slot. A lot of comments about this one. It's not about quality. It's more about access.
If there was a way we could connect the quality ratings to the child care slots.
That will limit us. We have measures of quality on such a small percent of the supply that if we're going to do it, I would argue strongly we do them separately, because if you're only going to measure, if you're going to only allow it to be access if you also know it's high quality, it's such a small percent, it's hardly worth working on. So we could do them as 2 different things, but combining them will will give us such an inaccurate picture of access. Does that make sense? I mean, and it's not that we know that the rest of them are low quality. We simply don't have a measure of their quality. So we can send a very bad message if we say it has to be high quality and accessible. We're going to be sending. We don't have the ability to report that.
We know we have an access problem also.
Yeah, I would think for sure we want to report the access problem as we know it and not limit it to access, and that we also have a measure of high quality.
Yeah, I mean, I know I'm one of the ones who said this isn't quality, but I agree with you, Bobby.
Oh, okay.
So in summary, we're keeping them,
I
right?
believe so, yes.
Okay, continuity of care.
I'm sorry, go ahead.
The continuity of care in ERDC. Suggestion on the table is to move to objective 6, which is children and families experience supportive transitions and continuity of services.
I think the one challenge is if you actually look at the strategies, it's almost all focused on the early childhood K-12 connection, and not transitions within early childhood.
Well, the other thing is, continuity is not equal to quality, but it is children cannot have high quality experiences without it. It's not sufficient, but, by itself, but the opposite is that, or the flip side of it is, it can't be a high quality experience.
Do people feel that the first three measures of Objective 2 would stand alone and that could be sufficient for Objective 2?
I think we should have continuity in here somewhere, David. It's so important. You know, and it's such an issue. It's such an issue in the ERDC program that it seems like we should be watching it.
Bobby, can I ask a question? Is continuity of care in ERDC has to do with children dropping in and out of care because they're losing their ERDC, or children dropping in and out of, or changing care? I'm not quite sure what, could you just explain that indicator to me a little bit more?
Well, there are two different measures. One is how long is the family in ERDC, and that's participation in the program. So how long is the child care subsidized? But the other is within the subsidized period, how long is the child with the same provider? And so it's two measures.
So the second one is what we're talking about here, in terms of the child's experience.
We weren't clear, but we could become clear.
For both of those reasons, I just visualize.
But actually, why wouldn't we measure both of them? Why wouldn't we report both? How continuous is participation in the program, and how continuous is participation in a subsidized arrangement, and report both?
Mm-hmm.
No? They're both important.
The program seems more like a self-sufficiency, family stability outcome to me, but maybe not.
Well,
whereas the child,
it's equally important for the child, because if the parent only stays on for 3 months, then that child's subsidized arrangement is going to be 3 months or shorter. So they both affect the child.
So let's go back to the Objective 2. Families have access to high quality, affordable early care and education. What's the part of this objective that we think we most want to get at with this measure?
Well, the reason I like there is because it's a prerequisite of quality. You can't have.
I would think.
I do think of it more of access. I think of if the child can only be there for 3 months, I'm thinking what's impacting the parent stressors so that they can only go for 3 months. Mm-hmm. Or like, did they lose the job? So now they can't have their ERDC, and now their job's ending. So I usually see it as more of a system goal. Mm-hmm. 2, like the healthy, stable, and attached families. And maybe it could be, I think it's important, it should be on here somewhere. Maybe it's a long-term system measure of system goal 2.
Which one would be a long-term measure?
Continuity of ERDC. Continuity of care in ERDC. Just like, or people, because the young parents, maybe they are going to school and then are not in school, or they have a job and they don't have a job. It is tied to self-sufficiency.
It sounds like it fits under Objective 9.
That's what I was about to say.
Mm-hmm. From the parent having the support piece of it, the Objective 9, and then the outcome for the child as far as access to high quality, affordable care, the child continuity of care in the same setting.
Yeah. And it seems like it belongs with the other
indicators in terms of rent burden, residential mobility, continuity of care. Those are sort of, to me, the same bucket of issues for families. And I kind of tie it, in my mind, next to young children in poverty.
Yeah.
Like how often are they coming in and out of your...
You don't do that. So moving continuity of care into objective time.
Yeah.
That seems aligned. I do think, I do disagree. I mean, that sounds like we landed on it, but I really do like the percentage of children with access to childcare spots, even though it's not going to be quality, but I think.
Yeah.
I think we all agreed that that was really important to keep in here.
Yeah.
Okay.
Can I ask a stupid question not to get us off, Ben? You can just say no. Is there any measure of affordability that we could use? Because affordability is not represented, and it is such a huge issue.
So
We do.
between access and affordability.
We do have a measure of affordability that we do every 2 years. But we, as a group, have not discussed putting it into the library. But such a measure does exist. It's a little, yeah.
No.
To me, that affordability seems like the key piece to high quality. I mean, that's, you know.
Bobby, can you walk us what that measure is?
Oh, golly, it's hard. Once we lost the population survey, we were no longer able to do the one that's very easy for people to understand. So now we talk about it as the price as a percentage of household income as indexed to 2004. Is it more affordable or less affordable than 2004, than the same measure in 2004? So, or you can
if my memory is right, it's a sort of generalized price versus generalized income measure. It's not.
That's correct. It's median
it's not
price.
This is how much this person pays of their income for childcare.
That's correct, because we only know that if we have a household survey. You have to know what parents are spending. You have to ask parents.
So it's a little bit of a different kind of measure, but it may be important enough to include. But I just wanted to make sure that was clear. It's sort of more like a benchmark than a measure.
Thank you. That's accurate. And get us back population survey, and we'll get the measure we really need, which is how much of their income are they spending?
We have that in goal 3, objective something, strategy something. Pat said he would put in money.
Oh, yeah.
Objective 3, high quality, welcome to culturally responsive, diverse early care and education workforce. 2 issues. One, my cryptic phraseology or whatever, diversity of ECE, should be diversity of ECE workforce. And then there were comments, well, isn't it more like the percent of diverse workers who are retained as providers or who stay in the profession?
Or it could be I don't know if we asked Michaela about how easy that is to measure. I mean, it could be done because it's longitudinal database, but, or do we want to know whether the percentage of the workforce that is non-white has increased or decreased? What is it that we want to know? Whether we're maintaining rather than it being on this individual person and whether they were retained, whether the percentage of workforce that's non-white has stayed the same, increased, or decreased. What do we want?
The latter.
Yeah, I think it's the percentage of cultural and linguistic minorities in the workforce, right? We want that to increase. Now, hopefully they'll also stay in, but if we're tracking a measure, that's what I vote for. And retention rate also, but.
Yeah, is it recruitment or retention or both?
Oh, retention.
Well, and maybe it's kind of the turnover rate.
Mm-hmm. Yeah.
Yeah, that's okay.
Well, I don't know. Okay.
right?
I mean, you could have turnover and still have an increasing percentage that's non-white. These are two different things. So it's kind of what is the important thing to capture? The percentage of the workforce that's non-white, or within those who are non-white, how long are they staying? Those are, they're not the same.
I mean, you could add another one that's specific to diverse populations, turnover, or we could just.
Yeah, we can look at it at both white and non-white populations, for turnover and, well, for the numbers.
Yeah. Yeah.
10% with BA.
Yeah, right.
But then we need two measures.
Right.
Okay, then Tom, then I think we're talking about two measures.
Yep, we've got them listed.
It is two measures, Bobby.
Yep. The other issue for this objective is mentioned by a couple people, whether we need a compensation measure, since the objective says a well-compensated workforce.
We do capture, we capture for center teachers the lowest wage and the highest wage paid, so we have a range. And that's captured every year. And from that, we know that wages are going up. Well, they're always going up, but how much they've gone up. And mainly we know their relationship to the minimum wage, which is way too close.
And how does that map onto the Bureau of Labor Statistics data broken down by professions? Is that at all a meaningful data source? Because that's
I could share a paper with you on, I was on a committee that worked. That is such an inaccurate measure because I could give you all the reasons, but I
believe you.
Okay. No, don't.
I was only asking, and again, because if I'm understanding the compensation measure, it's sort of a measure of childcare facility practice, not a measure of wages actually received by the workforce, if you know what I mean.
That's right. You're correct. I mean, we could use the BLS. It's just
not accurate. If it's not accurate.
It's really not accurate.
But you can't. So what I'm understanding, though, just so I want to make sure I understand this correctly, for the measure you suggested, what you wouldn't be able to say is X% of the workforce meets the following compensation standard.
No, you couldn't.
Okay. But you could say, looking at this measure of center wages ranges, they're moving in the right or wrong direction.
That's correct. Yes. And you could put it in relationship to the minimum wage, which is also meaningful. More challenging now that we have 3 minimum wages. But
so it sounds like we think we should keep that?
I'm wondering how it would be tied to affordability.
Well, I do think whenever you say affordability, it's also good to talk about wages, because otherwise people tend to assume that the reason childcare is not affordable is because teachers are being paid too much. So I always like to report these.
But also, if you go back to the objective, you think about high quality, I think it's covered in the education, well compensated, we would add culturally responsive, we have, well, we don't have culturally responsive, we have diverse.
I think we should.
Okay, we will add it to the list. Okay, objectives 4, 5, and 6. We talked about adequate birth weight. We don't have any measures for objective 6. The supportive transitions.
I thought we had adequate birth weight as long-term. goal.
We did.
Oh, good.
Objective 4.
Didn't get all my cards.
Yeah.
Okay.
So nothing for six.
Yep, and this is about it's really P3 measures.
I mean, we have a rough estimate of the number who get only through KPI funded dollars, though, which is a small percentage of what's happening with kindergarten transition.
Although, did we skip over objective 4?
Yeah.
I think there's.
I mean, and Sarah, I look to you on this. I mean, I still have a little bit of, these all seem to be really important things that contribute to health, but it still feels like we're actually missing measures of health.
Mm-hmm. Yeah, I agree. They're very processy. I mean, the first two align with the kindergarten readiness work.
Yeah.
So I feel like the way these four measures are really around what the health sector can do around getting kids ready for kindergarten, which aligns with what you were saying, David, before about the goal of the kindergarten readiness work group that we had. So I don't think they're bad, but you're right. They're not
telling us whether those
are what the health sector is doing. They're not assessing the health of the kids. The assumption is that they improve child health and therefore, kindergarten outcomes.
And I wasn't objecting to the presence of any of them, but part of me still wishes something complementary that got more at actual health.
I would look to our health partners to say, what are the early childhood health outcomes, kid outcomes that we could put in there?
You're asking the wrong person, because I can tell you what the Medicaid system does, which is why we have these particular measures. But it's going to be hard. I mean, this is the kindergarten work group that we had. I mean, we really were focused on the health, what the health sector can do to improve kindergarten readiness, and not. It's sort of difficult because was that Beth?
Yeah.
So it's like, do you mean just health of 6-year-old? What is a healthy 6-year-old? Or do you mean which I think is slightly different than health that is related to schooling? I mean, I guess happy, healthy kids, all of it is related to schooling, right?
Yeah.
And I didn't want to get us too off track on this, but
they're totally aligned with the objective.
Written.
The objective is about promotion and prevention.
Right.
What is the developmental screens on here?
That's on
the next one.
Okay.
Yeah. So maybe it's just something we keep on the back burner as a question, but it is a question that keeps on coming up for me.
But I will say part of, David, I think the difficulty is that we've had multiple work groups that have tried to look at this, and it's like there's not one health indicator. Part of why we have these process measures, right? Anyway.
Okay, objective. So we still have a big blank under objective 6. Just a note there. Moving to system goal 2.
We're doing a transition survey with part of the family survey. So there'll be some data.
Okay, but we don't necessarily know it would be an ongoing data source, though, right? It may be a one-time survey. Okay.
What was that part of?
The preschool development assessment.
Okay.
But some of the work for the PDG is also, at least was originally, could the state design a parent survey as part of the kindergarten assessment, which would make that permanent.
Yep.
Yes.
Okay, objective 7. Parents and caregivers have access to supports for their physical, social, emotional health.
Skip long-term goal 2.
Oh.
We're good with those, I guess.
Yeah, we added 2 from intermediary, the young kids in poverty, and the percent of families earning a living wage.
And we just added.
And added
Adequate birth
adequate birth weight.
Okay. Is there anything we can put in for the long-term measure around housing? Or
I was just going to ask about that. I didn't see and I don't know.
that's a long-term measure without question, but I'd love to see housing.
I mean, would the severe rent burden for families with young children, would that be a better long-term measure than a short-term, or medium-term measure, not least short-term?
If we're going big, long-term, how about homelessness?
Like housing security.
Children living in homeless.
I think, reducing the percentage of housing insecure or housing.
Mm-hmm.
I mean, get that one.
Well, I don't, Beth, you're not recommending that we give up rent burden, are we?
No,
Are you?
No, I like it where it is, actually.
Oh.
But
I'm okay with it.
I don't know if it's, short-term, long-term.
Chelsea, do you have any ideas about what the long-term might look like?
I mean, the one that we track for the legislature is around families, or I should say housing stability after 6 months. That's what we report to the state legislature, but I don't, so in my mind, 6 months to me is not a long-term goal. So I don't know that, I might have to check in with Megan on that one. Because I would like it for it to be, I think it should be aligned with how we're tracking it, but I don't, I also don't know that that's the only thing that we can be tracking. I'm kind of curious about, because that housing stability at 6 months we're not necessarily talking about being rent burdened. And so I'm curious to know if there's another measure that kind of specifically looks at that. So I have a little note that I need to follow up with Megan about that.
Are you suggesting that maybe housing stability after 6 months could be a objective 9 indicator? I mean, that gives us
But you could then move your rent up to long-term out.
Oh, that's true. Let's go with the poverty.
Well, we've got residential mobility. What was the measure for that, Tom?
What was that? The 6 months? That's not necessarily.
It must
mobility,
be.
so.
I think it was a measure.
But it must have been what we had.
Yeah, we were discussing it, but I don't think we got to a decision point, so it was still on here.
Okay.
We talked about the difficulties of measuring it, and then, so I just don't know if we decided to remove it or not.
Well, if you had the residential mobility and if you look what Chelsea was talking about housing stability after 6 months, wouldn't that be a big indicator would that work? So I think that would capture that. I think severe rent burden for families with young children, that would be, I think that's also, again, that could be a long term.
Yeah.
What about is there a percent of homelessness? Like, isn't there a day or two?
There's a point in time count, but we've also.
The point.
Chelsea talked about the limitations.
But the thing about the point in time count, though, that I always think is really tricky is that happens literally at one point in time, and I don't think that that's a good measure that's going to encompass all of what I think we want to know, because there's going to be populations of people, when you look at it from an equity perspective, that you're not going to get during the point in time count, because people figure out other ways to couch surf or to double up, but they're still unstable. So I always struggle with the point in time count a little bit.
Yeah.
Okay, so we've jumped around a little bit. Back to objective 7, preterm birth.
But it seems like what I did here is for the long term, there should be something around housing in the long term.
Yeah. Yeah, I think so.
There, I think that's what I heard from folks.
And that severe rent burden should move.
Mhm.
Is that also what you were saying?
I was offering that as a possible long-term. But again, we can address that when we get down to 9 if you'd like. But if we are talking about housing, we are looking at a housing outcome for long-term, or system measure rather.
Okay.
Could that possibly be
You
one?
can just like put in italics, like need a housing measure.
Okay. What was the other one we were talking about? I was right about, add one, but
So the residential mobility.
Residential mobility with housing stability after 6 months.
But that would stay
That's kind of
under
one.
9. That would stay under 9 though,
okay,
so we're not down there yet.
so some housing measure for now, up there.
Yeah,
Okay.
severe rent burden has the advantage of research showing it having such a strong impact on child outcomes.
Mm-hmm.
It's the same as mother's mental health, I think, or mother's education. One of the other, it's a very strong predictor. So it
I
maybe
definitely
does-
think that we should be tracking rent burden.
Yeah, I do too. And I can't remember the conversation, but we thought we had a data source for it.
And it's measured at the population level?
Yeah, that's my memory, but I'd have to find notes. That's why I was hoping somebody else remembered exactly where we thought we could get that.
Let me see. I've got that as a note down too.
Okay. So barring any objections, back to objective 7, keeping preterm births there as an intermediary measure. Okay. Maternal social support was suggested to move to number 8 because it relates to having opportunities for connections. Any opposed?
Yes.
I'm not sure the way the objective 8, when you look at the strategies, is actually defined is the same.
Social support is multidimensional, though.
Right.
It has to do with interpersonal support from family and friends, as well as feeling supported by systems. So.
And if I remember how the question, well, that was my question, is the question more on your sort of system of like friends and family social support?
Depends on the measures. The good ones have multiple.
Oh, okay.
But I don't know what the measure is.
Because it felt like I guess my thought was if it was more on the family and social support, I'm not sure that fully meshed up with objective 9. Yeah.
Objective 8.
Objective 8.
The strategies are universal connection point for families with newborns and paid family leave. Yeah. That's why.
Wait, say those again?
Universal connection point for families with newborns
Connection.
and paid leave.
So I think the connection there was loosely meant to be able to.
One's with
Parent.
baby and one's with
I know.
services. Okay.
But that sounds like connection with your baby.
The second one, the first one is connection to services.
Right.
Right, maternal social support doesn't get either, though.
And that, yeah, that was just, I guess, was.
Your point.
As I said, I will admit that that was an objective that was built around the strategies, where most of the other ones, the strategies were built around the objective.
Okay, so I think we now have keep it in objective 7.
Yeah, that makes sense. Yeah.
Yeah.
Mm-hmm.
And we have nothing for 8.
Can I be annoying and take us back to the preterm birth one?
Yes.
Yes.
It won't be annoying.
So this is one where there's a huge link with adequate birth weight for that measure, and then also the measure that's above it in terms of adequate prenatal care. I mean, part of adequate prenatal care, a piece of it anyway, is around preterm birth. And it's not I mean, again, you look at some of these other things here, other than like the parenting stress and family sense of hope, and they're more processy type input type measures, but the rate of preterm birth really isn't. There are a lot of factors that go into that, and it's kind of like with adequate birth weight that, I mean, there's been a lot of policy work around this in terms of Medicaid will no longer pay for early elective deliveries. So that takes care of a policy piece there. Hospitals have put a hard stop on early elective deliveries. Again, that's a policy piece. My point being, a lot of the policy pieces that we could put in place to address preterm births have kind of been done. So thinking about this as an intermediary measure for me is difficult, because it really is all of these other social determinant of health type things that will have an impact on that. That's my plug to question. Go ahead.
So would you suggest moving it to long-term?
Yeah, that came from me. I was one who suggested. But then yes,
I'm
that's my
having
first
a
one.
flashback that maybe at one point we had both of these under long-term for this outcome, and then we moved the low birth weight into kindergarten ready, we moved the on-time birth into kindergarten readiness to have something in health. I think is what I'm having this flashback. I don't know if that's actually true memory.
Well, and then if we do move, so I don't, for me, this is, if you think about looking at the health measures here that are around intermediary measures, which are things that the health system does, this is more, to me, of an outcome type measure around preterm birth. But then you have adequate birth weight as well as preterm birth, and they're so related. That's where I struggle with having both of them as long-term metrics.
If Sarah, if we were only going to have one, which is the better one, adequate birth weight or rate of preterm birth? If we were going to choose between the two.
Oh, don't make me do that. Don't make me do that.
Good choice, Sarah.
You put the question on the table, Sarah.
I did. So what I would propose is that we put them both in there now, and we seek additional consultation. But these are so related that we really want both and get. I'm punching it. Kick the can.
That was good.
So move it to long-term, right next to adequate birth weight, and then seek consultation. Is that what you recommend?
Yeah, I think I can't tell you which to have, but they are so related. I don't know if we really want them both in there. I do think they are both long-term goals, though.
I would vote for scrapping it.
Well, I'm just saying that there is that window between 36 and 40 weeks that isn't considered necessarily preterm, but you've got a low birth weight baby, and that there are significant outcomes that are associated with that. So that's why I think both. Yeah, I'm with you, Sarah, because I think there is that window of time.
Yeah. And my gut instinct on this one is folks are going to have very strong opinions on this one, so we probably wouldn't want to make a choice without consultation.
Right. I agreed.
I deleted it. On accident. Okay, what was it again?
With adequate birth weight, you could have
rate of preterm birth.
You could have a baby born at 40 weeks with very low birth weight, and it would still be captured. That baby would still be captured. But if we were meant to choose a measure.
Okay, so
I think if adequate birth weight captures more.
Just in terms of process, we're at 213, and we're on our first activity, right?
Yes, although the next two I expect to go much more quickly.
Okay. Okay,
Hopefully.
good.
I'm hopeful.
Okay.
Final comments on our mapping to Raise Up Oregon? Going once, twice, 2 times.
Well, have we finished Objective 9? Okay. I thought we were sort of weighted on some of these. Did we come to a conclusion on the housing measures?
I think the residential mobility, the housing stability after 6 months, I thought we were going to leave under 9.
Yeah.
And I think we were looking at trying to out of housing outcome would be under,
Yeah.
well, that's what Chelsea was gonna circle back and see if she can get a long-term housing.
Yeah.
Do we want to keep
Yeah.
for now?
Around the, you're talking about around the.
As an intermediary?
So, yeah, that was the other thing, David. I think the other was the proposal about moving severe rent burden for families with young children up to the long-term.
Yeah. Yes, that's the note that I made. That's my follow-up.
Just noting, and this is not for discussion, but just to note that we have all these housing ones under the objective relating to access to coordinated services, which is a little bit of a disconnect for me.
Yeah. Yeah, although this is also where, if you look at the strategies, most of the housing strategies are in the plan.
Right.
Yeah, and that experiencing adversity is, I think, the key language there, yeah.
Okay, we are done with task 3? Yes?
Yeah.
Okay.
We knew this was the bigger of the tasks.
Okay. Everybody gets a gold star and a Jack Weiser gold star for their homework. Everyone here participates. Okay, next task is related to sectors.
And I will point out that now that we've changed things, the next task won't fully map onto these assignments, but that's okay, because this was about stepping back.
Yes.
Green or blue?
Mine's got it.
It's on the back, on the one with the blue boxes.
Like the categories of early care and
Yes. And I know I wasn't very clear here, and some of my headings could have been better, so I took the OPEC measures, the parenting ed measures, and moved them to early care and education. They were considered part of human services, I think, and clarified that I think I changed anyway, I just put DHS, includes child welfare. And I think, the goal here was really to see, okay, are there measures in here which can engage our partners? Are there measures that, somebody can own? Can every sector own a measure? And are there any that seem to be kind of floating out in space where there's no real sector assigned?
And can I add, like say, yeah, we might want to jump on that one as well. I think percentage of children with access to a child care slot. I think that might go over to DHS.
Okay.
Mm-hmm. And is it OKA?
Oh, no. Just a second. That's much bigger than the children who qualify for ERDC. That's the whole supply, all children. That's like the mapping of supply population.
Yes, I think what Bill was suggesting is that's something that DHS also feels like it has responsibility and interest in contributing to.
Oh, just add, not take away, right?
Yeah,
Perfect.
And again, we can argue with a lot of.
I'm sorry.
Not always Bobby. Most of the time.
Yeah, great. Yeah.
Okay, also go under K-12 because they have a lot of pre-Ks now, and they also own the data.
I know. I wondered about that.
Yeah.
Trying to get K-12.
Where I landed.
Yeah. We can give them a slide.
I know. And kind of, on some exercises like this one, I tried not to
have everything, but no,
Okay, so we'll put K-12 as well.
But I have to say, like, my first blush when I look at this is I don't know if we have enough measures here to fully engage K-12 in this conversation.
Kind of what
Yeah.
Looks like, what is K-12's role in early ed besides EIECSC? But now they have pre-K.
And it looks like we have just a typo in it, continuity of care for in ERDC instead of having it with DHS, you have it in Housing and Community Services.
Whoops. Thank you.
And I know I was struggling with keeping my
Oh,
line.
this one you just mentioned?
Mm-hmm.
Okay.
Yeah.
Yeah,
Wait, that's not where that goes.
Would K-12 have anything in home visiting?
What about diversity of workforce?
It's only childcare.
That's early learning workforce.
Yeah, that should say early learning, shouldn't it?
Yeah.
But I guess that's the question is,
Sorry,
go ahead.
I was just gonna say, once you get a transition measure,
Mm-hmm.
K-12 owns at least half of the transition.
That should be diversity of workforce.
That's true.
I would like.
Yeah. And we actually do,
Get in the game there.
and we actually do, to be honest, I think on this work group, we need to also, we sort of lost our K through 12 person, so I'm not sure, I'm also feeling like we don't quite have anyone at the table to say, like, hey, K-12, do you feel ownership of this? So I think that's also just something that we need to sort of note and address.
Good point.
We can't assign them to.
Yeah. I mean, I would love if they felt ownership of all of the KA measures, but I feel like someone from ODE needs to be here to say, yes, we feel ownership over those measures.
Do they do any kind of measures around frequency of reading to children? It's really early one.
You were suggesting what?
No, I wasn't suggesting, I was just curious about frequency of reading to children, if that was just pre-K.
The way we measure it is,
What about the preventive dental exams? Is there a requirement? I know in California, I don't know in Oregon, I know in California there's a requirement for kids in kindergarten to have preventive dental exam and documentation of that.
I think they do now.
Would K-12 look at immunization rates?
That's what I was just thinking.
Oh, yeah.
They might know.
Childcare programs require them as well. You have to have immunization records to be in childcare, licensed childcare programs.
To the extent that immunization is a gatekeeper, or something they can make people do because they have to go to school and go to childcare.
Do you have a sense of like who we could walk this over to in ODE and say, where would you put an X? Or is there something that you think is obvious that should be here that's not here where you also would put an X? Is that a Brian Reader? Okay.
And again, the purpose of doing this mapping was really to identify who holds the data, sort of who owns the data.
Not who owns the data, we have a different map of that, but, you know, if the sort of going back to the original logic model, both for the plan of these long-term goals are goals that's going to require everyone across every sector to contribute to, but we also need to have a place where each sector can see not just the light at the end of the tunnel or whatever the appropriate metaphor is, or North Star, blah, 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 and also see in their contribution to this and have that sense of ownership. I think that was part of what we were trying to get at with this exercise.
I appreciate that. I'm just, thinking about things like immunization rate, like not wanting to water down sort of where it belongs. You know what I mean? If it really belongs in the health sector, but both pre-K and K-12 have strong feelings about that, you know, or just rules around it. Does that, do we include them?
I thought that the main thing we wanted to get out of this was, did every sector have their toe in the water? Did we have X's for every sector? And rather than being, so when you look into the future and what we're doing with the measures, this isn't the question of who holds the data. This was take a look at our library and be sure that every sector can see themselves.
And I have to
So
say, I think other than kindergarten attendance and third grade reading, I'm not sure it gets to where K through 12 feels like its energy is. I guess it's just my observation. Excuse me?
Can I ask a quick question?
Yeah.
Is this piece of because when I look at this, I'm also thinking about there's the other document that I think maybe the full council is looking at that's got like the half dots. It's part of what we did at the retreat, and I feel like that is really the space where, like for example, like we may hold if you go further down, I feel like we would at OHCS be thinking very carefully about the residential mobility and the severe rent burden. But I also think in terms of like where we may not be directly responsible, but we're really interested in like family sense of hope, or even thinking about like kindergarten attendance. While we're not directly responsible for that, I would be interested in that because I think that if kids have stable housing, they're more likely to have better kindergarten attendance, right? So I may not be directly linked to it, but I don't know. My understanding was that this document that we're looking at now we're not necessarily thinking about that. This is just about, like you said earlier, is each sector have like some kind of main ownership, and then there's kind of another backdrop document that says we may have some ownership, but we also are really interested in these other places and may want to be a part of that in some way, shape, or form.
So I would say this, so I think along the continuum, they have like specific responsibility ownership about gathering the data. You have an interest because you know it's going to impact your outcomes. And I think something like immunization, it may be more around health, but I think for education in K-12, I think it's an indicator or a measure that they're extremely focused on based on populations they have to serve. So in the absence of having it, so I would say I would, without question, see immunization rates be something that K-12 would be very fixated on.
The exclusion date.
Yeah.
Right. And I think there's another one that's sticking out for me just because of conversations that's happened in our region. It's the other end of the spectrum with K-12, but the percent with BA or Step 10 workforce in our high school programs. CTE, they're doing grow your own models in partnership with colleges, dual credit, dual enrollments with high schools and community colleges. So they're starting that pathway with the workforce.
Yeah, that was a big part of COSA's proposal. Yeah.
Do you have an idea for a measure?
No, the BA stuff. No.
I mean, we use the same measures, but to just acknowledge that it's K to 12 that also has a stake in it.
Yeah, it's more of an adding them to it, not.
Right.
Yeah. I mean, maybe you could have different symbols like primary stakeholder.
Yeah. Although this is like a publishable, I think this was more just for our own, like, where are we in the process?
This is one you kind of hold up to the committee real fast.
Right. I think visually, just to get a sense of all sectors covered, then I would say yes, they are.
And I think this discussion.
I'd agree.
So I don't want to go into a rabbit hole, but I feel like just to put it out, the percentage of BA or Step 10 for the workforce for childcare slots, not all providers. I mean, that's not really the population for a lot of our providers. Right. And so for the likelihood of them ever having a BA, it wouldn't be a desirable goal or an objective, but they would still be a provider. For instance, licensing them to family, friend, and neighbor. I mean, that's the care that a lot of our folks are getting. So I would just caution if we're saying that's going to be our objective is to increase the number of BA, which I appreciate, but I just want to make sure there's all the recognition that that's not going to be all providers that we're going to support.
And when we change the steps too, so it's presented with BA or steps 5 or 9.
Right.
All three of them.
Yeah.
which gets it more of the training.
Yeah. Yeah, because they relaxed those standards for preschool promise, where they didn't have to have a BA. Although initially they did, I think, so.
I would be curious to see too, out of these measures, the ones that end up being long-term, if all these partners have at least one long-term measure that is there.
That's a good point. I'm guessing we do because the long-term ones are so, like, multiply determined.
Probably, but if we had to separate, you know, like I just want to make sure that somebody doesn't end up without one. You know?
Oh, here it is.
So.
Health service.
Kindergarten, physics, health.
Okay.
DHS.
We don't have one for early care and education.
That feels like something we could come back, Tom, with at the next meeting rather than taking the time to do now. I'm just.
Actually, I just did it. Actually, I just did it.
And we're good.
We're good.
Yeah.
Actually, as long as we add a housing measure to the long term, good.
Yep.
Okay, great.
Okay.
Yeah, actually it came out quite nice.
Task 2, wrapping up, last comment, 3, 2, David. Any last comments? Any last comments? Or task 2?
Oh.
The one we were just talking about. Blue boxes, going once, twice, gone.
Okay, thank you, Tom.
Other side, green boxes. This one, again, with everything being related, it's kind of like, well, if you mark one child outcome, you should mark all the child outcomes.
Tom, can you move, Tom, we don't
Yes.
have it on our screen.
There you go.
Thank you.
And again, I guess the exercise was sort of similar to not to sort of try to hold it a little bit, a couple feet away and sort of ask the question, are we, in a broad sense, getting at, this is the key domains that we had sort of identified earlier.
Color is the light green is what we previously, the darker green is ones I added based on your feedback, and the reds were either typos or I had them in the wrong place.
So we're red or gray?
It looks gray on our,
Yeah.
Oh, looks gray.
Different here than up there.
Okay.
Okay, so I think, this is Bobby, and when we sent you out the task for the homework, we inadvertently made it more difficult than it needed to be. So, and I think Shannon's comments and some of the others of you added to it really made it clear that this level of whether direct or indirect, what we is a much harder question to answer, and it wasn't the question we were trying to answer. We wanted to be sure that we didn't end up with the measures affecting, being associated with a specific, all with the same developmental domain, or that some developmental domains didn't have any measures. So yeah, I think this is what you are referencing when you talk about stand back, David. It's kind of look at the big picture and ask the question of, do we have measures addressing all the developmental domains? Are there developmental domains that don't have any measures? Tom, David, is that, do you think?
That seems accurate to me.
Right. This was sort of meant to be the stepping back month to sort of take stock of where we are in the process, right? So we wanted to look at it through the three lenses of alignment with the plan, sector buy-in, but also going back to our original rubric, which was around, what are the sort of key domains that we think are associated with those long-term goals.
Oh.
Right.
Can I ask a question about the color coding?
Sure.
So the pink represents what you believe is a mistake?
Yes, well,
Because I did.
where I changed my mind based on the group opinions.
Oh, so okay. So I'm the only person that thought, because about kindergarten and attendance, I think I had said in the last month's meeting that birth, mother, caregiver, health relates to that. Simply because a lot of absences for children in school are a result of the health of a mother or even a sick sibling. So I think so that's why I put them there. I realize it's not intuitive, but attendance, I have a lot of experience with K-12 attendance tracking. It really makes sense. It has a lot to do with parents at this age especially.
Yeah.
It's not about the kids.
Yeah, no, thanks for bringing that up again. I couldn't recall everything as I was going through here. Any other comments from mine?
Do folks have just sort of any other high-level observations?
I did clarify, not for you, of course, I made it complicated as well. That healthy parent relationships, or whatever was listed, was healthy parent-child relationships. But other than that, I think the coverage looks good.
Yeah, it looks like every measure has a domain, and all domains have a measure.
Yes.
Okay. So we have about 23 minutes left. I'm wondering if we can, just going back to the beginning of the meeting, if it would make sense just to sort of to broaden the last discussion. We talked about what's the appropriate equity review, and I want to make sure that's on the list, but it also feels like it may just be worth having in the 23 minutes left, going back to, now that we've done sort of taking stock, what do we feel like, what's the work that we need to do to be able in September to make a set of recommendations to the council in October. So having taken stock and done this exercise today, what do folks feel like is the additional work that we need to do to be ready in September? I don't know if that sounds like a meaningful question. I can see a question on your face.
What do we need to have ready? Can you clarify?
I think that's a little bit up to us, right? But I don't think we need to. I think what we need to hand and Bobby, you should pipe in, is something to the council that has the long-term goals, the long-term population measures for the two goals, and has measures for each of the objectives. I think one of the questions we can have over the next couple, would be also, do we think it's better to give them sort of a broader library? Do we think it needs to be winnowed down? And if it needs to be winnowed down, what are the processes? Does that answer your question? Okay. I don't think we need to say baselines and targets or any of those things. So, but I think I think what we would like them to approve in October is the long-term outcomes for the two goal areas and measures associated with each of the objectives, I think. And Bobby, as the only council member here, does that sound accurate? I should defer to you on that.
I think I do, and my concern is based on the last time we reported at the council that the equity lens is going to be the focus for council members, and they're going to ask us, the extent to which each of these can be measured, broken out by racial, ethnic groups and whether, and I mean, we got asked the last time, and if we're not going to do benchmarks, maybe we can skip this part, but they're going to want to know, they wanted to know, is are the standards racially specific? So if it's adequate birth weight, have the standards for what is adequate been set in based on research that takes into account differences occurring for different racial populations? And so I think I'm pretty sure if we're going to go to the council in October, that we will have to have done that work before we go.
So yeah, Bobby, I was thinking, your first question I think is easier for me to address or for me to think about, which is we need to identify which ones we can break down by race, ethnicity, and honestly, if we can't, I say throw it out. Like that's not.
Well, but we might not have anything left, Beth.
No,
I mean,
that's not.
A lot of these can't be broken out.
True. You don't think?
Okay.
Well, I'd want to see that.
I mean, can I?
Okay.
I think that
that's
there
what
are
we'll have to
probably
look at.
several that can be broken out, but I think I guess in my mind, this is Chelsea, by the way. I guess in my mind, it's not just whether or not they can be broken out, but how far down can they be disaggregated? So like if I talk specifically about like housing measures, like I think in our agency still have a lot of work to do about digging deeper. So like with the Asian Pacific Islander category, like that has to be way disaggregated down, and that's going to take some work. So I think that probably a lot of these can be disaggregated. I think in my mind, it's more of a question of how far down you go. And then the piece around like defining what's adequate, I feel like that piece that's a big conversation. And that feels a little tricky by October, just off the top of my head.
I agree with you, Chelsea. I was just thinking because we disaggregate and then we tend to center white folks, right? So that's always the comparator. And so to what extent can we come up with other kinds of comparators or norms or standards? That is a way bigger ask. I agree with you on your first point too. Yeah. Maybe that's something we could find out, like what are the categories they keep track of? What are the groups and cost indicators, and what are the ones where the data is not deep enough?
Right.
So, David, I think the questions that have been raised are the ones we need to have. I don't know if staff can do all this work, but those are the ones that we need to address and have a plan to have that done by September.
Do we feel that there's any other additional work that needs to be done? You know, we have the sort of edited version that we did today. Is there additional work that this group feels like it would also want to have done to be able to make a recommendation in September? And again, one of the things I keep on thinking about is we sort of put off the question of like how many measures per objectives or for the whole thing do we, you know, and it could be that we keep it broad, or it could be we refine it, but that still feels like a question.
So David,
David, I wouldn't
winnow
do
down
that until
before we go into finding out the demographic disaggregation possibilities?
Thank you.
Well, what I'm trying to do is at least have just the reality of we probably don't have that many more meetings between now and September, right? So I just want to know if we were to put together a work plan, what are the things that need to be on the work plan? So not getting to the order in which the work is done, but what's at least do we have a shared, I want to see if we can get to a shared understanding, at least partially, of what work do we need to do before September. It could be that we decide that we don't need to do a winnowing discussion, that we want to give them something broader, right? But at least want to make that an intentional choice.
I feel like it's going to be hard for this group to winnow more.
Okay.
And we've done on our due diligence that we represented this way, that way, and the other way. I feel like there's a few that have like 3 to 4 seems, somehow pulling numbers out of hat seems reasonable. More than that, maybe not. But
And, to be honest, that was actually sort of the conclusion I came to myself today, is that we don't necessarily need to do winnowing, but it felt like at least needs to be something discussed. And if that's not additional work we need to do, that helps us get to September on time.
And are we still wanting to explore additional measures that are more of the outcome itself versus predictive measures? Or no?
My recollection is there's 2 objectives that don't have any measures within them. So I'm thinking like that's kind of the focus so far, and the winnowing might occur with the equity. I don't know. But so far, there's 2 objectives that have no measures after the editing.
What are those?
6 and 8.
And there are places,
go ahead, sorry.
I was just gonna say, and there are places where it says, add home visiting measure, that we haven't quite.
Well, those measures don't exist yet, I think is what you're saying. 'Cause it's
Family Connect,
yeah.
But I did get the information from North Carolina on what their data tools look like, and I've sent those to David and Bobby.
I kind of agree with you, Emily, but I also feel like we did so much work trying to come up with indicators, and just kind of like, I mean, the reality is our systems just haven't been set up to track data in these areas.
Yeah.
And so I would almost advocate, I haven't thought this through, so take this with like, we need these data, but it doesn't exist. So let's figure out a way to collect the data in a better way in these areas, rather than trying to like round peg small hole, like round peg square hole, something that doesn't fit.
I thought about that too, because we were trying to overlay the measures with the objectives that were created with the council. So it's like maybe some of them just don't fit. And certainly if we try to find them, then I start to think ahead to the equity conversation. And I don't think it'll be fulfilling.
I think we could still, to answer your question, Angela, we could still add a couple measures, like especially where there are big gaps. But other than that, I think we've probably run the list pretty well. We have 9 long-term outcomes for goal 2.
Yeah, that's a lot. Because it's so broad. And again, we're trying to get all the different pieces, right? You're trying to get food and housing and poverty and health.
Well, healthy, stable, and attached is the loaded, chock full of stuff right there, yeah. Right?
Yeah.
Easy peasy.
Right, no problem.
And
Right.
I still have a little bit of misgivings that there's nothing in the long term that we're gonna consult on that, yeah.
Coordination.
For health in goal 1. That is,
Kinder ready.
yeah, that it tends, there's sort of more cognitive.
I mean, Ed Ziegler talks about access to food and meals through childcare. I don't know if that's a long-term outcome, but that being one of the critical drivers of early childhood care and education success in kindergarten.
Is there a way of getting kind of a universal measure?
Access.
I mean, you can get SNAP, you get SNAP, but you don't have a universal measure.
There's that like
Not yet.
normal measure that we tried out. It's
Right,
the
what was
not
that?
the meal.
Right.
The county level
But
measure.
David, I was really struck by what Sarah said, that groups have worked, knowledgeable groups within health have worked to do that and haven't found one. So I'm not sure. I hear you that it's missing, but I'm struggling with what would be a constructive thing to do when people who know even better than this group
Yeah. So I guess,
said there is,
like we were talking about for Objective 9, is there maybe just a way of calling out its absence? I mean, I would at least want people to know that we had this conversation and they'd try to.
I think that's a good point.
Right, I wouldn't want people to read this and say, you clearly didn't think of health as contributing to school readiness, right? Because that's part of what measures send, is like what you think is important, right? So I do.
If I think about how all systems are involved, I wonder if we can just have that as, if we can have some things as placeholders, as, you know, Objective 8 doesn't have indicators.
Right.
Objective 6 doesn't have indicators. We'll have this next round of going in and getting consultation for some of these follow-up things. But then, you know, maybe there are places where there is something there as a placeholder, and we just know, you know, whatever it is that we give to the council, it is in a different colored font.
Yeah.
Something like that to indicate, like, this is something that is and would get at this objective. And
At least just
we don't have it.
emphasizing somewhere that, you know, this is step one of the process. Hopefully over time, we're going to improve the measures and the data collection.
So if there's a way, I think if there's a way that we can call out the intentional holes so that they're not, so that they're acknowledged as.
There's a discussion we're looking at.
We looked at this, this was recognized, and it's not there because we don't think it's important, but
Actually,
when we talked to the experts, they couldn't, at this time, they weren't able to provide something that filled the space.
And as opposed to even removing it, we wanted to keep it there, to dig down.
Yeah.
Exactly, to dig down deeper to get it more intentional.
You could potentially put food insecurity there. Because we were talking about it as a stable family kind of measure, healthy family, but it's also, you know, the kid needs to be eating healthy for the first 6 years to arrive at kindergarten.
But then I think we would be back to adequate birth weight.
Let's hold where we are.
Yeah, agreed.
Hold where we are, and I think maybe we did put that placeholder with a caveat that we are looking into it, we're reaching out to it, giving it the time it deserves, so we get the right answer in there, as opposed to just rushed answer.
So just in terms of our internal work and what we could bring back, so it sounds like we can start the review of how the data is disaggregable. We can work with our partners to at least get some.
Yeah, some of it gets tricky.
Yeah, no, it gets tricky, but at least I think we can do some work to report on that. And then could we also come back with maybe some way of suggesting a call out for those spaces for people to give feedback on? Yeah. And then I think there was the additional review of, that's more on how the measures were created, and is there bias in the measures, that I think is a more challenging process that I think we still need further conversation on what's the best path forward to get feedback on that.
I think we need expertise in that area to help guide us. I certainly couldn't really speak to the standards as.
And I actually did have a conversation with Sarah today of, she thought there might be some opportunities through Build for some technical assistance.
That would be cool. Yeah.
One thing that I can offer.
Yeah.
Oh, go ahead, Chelsea.
Oh, no, I was just agreeing with the conversation in the room. That was the technical assistance piece. That's it would be really great.
I was going to offer, although Alicia may kill me, is that one of the things that we're trying to do with that PDG needs assessment is make sure that we have in that data that we're compiling all of the measuring success measures. And in the process of doing that, we will be finding out exactly what we can get in terms of racial ethnic breakout in those data sets. I'm not promising we can do it for all of them, but I think we would have that information not by the next meeting, but possibly by the July meeting.
That would be wonderful.
That's great, Beth.
I won't be at the July meeting, but Alicia will probably, hopefully.
The one thing I was,
Sarah.
Go ahead, Sarah.
I was just going to say on the health pieces and the placeholder, David, I do really want us to highlight that we think that health is really, really important there, and certainly highlight the intermediary measures. I think other potential placeholders, I mean, we could look more at the BRFIS and see if there are things, because I mean, the other groups that have looked at this, we were also trying to look at something that could be available in the CCO measure. To your point, we weren't really looking at population-based metrics, so I still think it will be difficult. So perhaps it's another look at the BRFIS. And then the other piece is that for the health aspects of kindergarten readiness work, I mean, we have the well child visits and we have the preventive dental visits, which we have as intermediary measures. But one area where we are doing some developmental work is the second part of that strategy around social emotional health, and what CCOs and health plans can do. That's something that won't be, we're developing it. It would only be CCOs, and it wouldn't be, ready for another at least year, but it's something that we could consider moving forward in this placeholder space. And then finally, I know we had kind of gotten rid of looking at coverage for kids, but maybe a potential placeholder could be something around health and insurance coverage for kids. So I will tell you, we're doing quite well as a state because of the Cover All Kids legislation, but that potentially will not, I mean, it's again not truly an outcome, but it is something that can be moved both year to year, but also in the long term. Anyway, so those are thoughts about the placeholder.
Uninterrupted coverage.
I was just going to mention something like PRAMS, or the new PRAMS that's being developed now called the ECHO.
Oh, is that right?
Yeah.
I didn't realize that.
That it depends on their recruitment, their follow-up recruitment rates, because if they don't get enough people in, then you can't disaggregate by race, ethnicity, or you're stuck with white on white or something.
Okay. This might be just getting into the weeds, but really quickly on the in terms of the Spark rated programs, or would you want to try to disaggregate by owner, leader?
Oh, yeah.
And would you just leave it as we're not gonna?
You can do I think, Bobby, correct me if I'm wrong, but I think you can do percentage of their staff who are racial and ethnically diverse in certain categories. I'm not sure how accurate that data are.
Could you, sorry, this is going to be like a question. Could you do like a geocode and do something of the diversity of like the zip code or? I mean, it wouldn't be a sort of a perfect measure, but at least get something at our programs located in places where they actually have the potential to serve a diverse population. I mean, it's still a couple steps removed.
I think we tell a different story.
That would be very important for Spark, where the concern is that the quality rated programs are in areas where the parents can afford to pay higher fees. I don't think we can break down staff, Beth, we'd have to talk, the Spark ratings come out of TRI, but so we'd have to ask them your questions.
But we
the Spark rating data.
We linked the Spark ratings to the workforce data, is what I was thinking. But it would take some work.
It would take a lot of work because the race ethnicity is at the individual level.
Right.
And yes, those people are linked, but it's a lot of work.
So do folks feel like A, okay, clear about next steps, and B, do we feel like we're on track for an October?
I think we're well situated. I think it's a really good discussion. I think I like the end product today.
Agreed.
But that's just me.
With you, Bill.
Great.
I agree, Bill.
Okay.
What is our next step
I
for
agree too.
our meeting for this group?
We come up with that 2 days before.
Okay, great.
I do, I do think we do that. I mean, that we have some work synthesizing what we've heard today before I'm clear in my own mind about what's the most important next step.
Right. I mean, I feel like by June, we should be able to report back whether we have secured what we think is technical assistance that will help us, but I'm not sure that there will be, by June, an opportunity to have gotten technical assistance and feedback.
Sure.
Oh, right.
Yeah. That makes sense.
So stay tuned.
Okay.
I think that may be your first and only homework assignment because you did it so well. It made my head swim.
This is not our first homework assignment. We've been giving folks homework all along.
Thanks, Tom, for all your
Yeah,
work.
thank you, Tom. Appreciate that.
Yeah, you guys did an amazing job of the homework. So.
Well, thank everyone. Bobby, enjoy the beach.
Thank you very much. Wish you were all here.